Doctors of Reddit, what is your craziest story where a patient present with mild symptoms, thinking it was nothing, and it turned out to be a serious life or death situation? Many years ago, when I was in my residence, a man entered ER with a hand in his forehead, walking by himself, asking for a doctor. You can imagine my surprise when I said yes, to him removing his hand and showing his injury, a perforating hole from a bullet. He was quickly moved to surgery after that. Later I found the bullet didn't reach the brain, it was well buried into the skull bone. A man came to the hospital because his wife always complained about his bad breath. Long story short, I met him because they consulted my department when the tissue biopsy came back as esophageal cancer. I'm a dentist. New Point came in with what he thought was a mild ache in his teeth. Thought it was a toothache. Hadn't seen a dentist in years. Took a radiograph and the jawbone around the teeth looked strange. Had him see an oral surgeon that day. Turned out was a very aggressive metastatic bone cancer and died a few weeks later. I'm a nurse, not a doctor, but we had a guy come in years ago asking for a medication to help him stop sweating. He said he had had a sore throat for about a week, went to a walk-in clinic, was diagnosed with strep throat and put on antibiotics, but he was so sweaty and just wanted a break from it. He looked pale and was indeed sweaty, so we took him back and ran some blood tests. His white blood count was the highest I've ever seen and he was diagnosed with leukemia. We sent him to another hospital for immediate treatment, but we were informed he died literally hours after arriving. Incredibly sad, I couldn't believe it. Patient's wife called. Patient had a temperature of 98.6. No other symptoms. I explained that was a normal temperature, but the wife said that's a fever for him. She said she felt like something was wrong, despite no other symptoms. I told her that I respect that and that if she feels something is wrong she should get him checked out in the ER. The ER doctor called 4 hours later and said they did all they could do for him, but he died of sepsis. He appeared to be normal when he got there, but rapidly declined. That gave me a new appreciation that we truly can't evaluate someone thoroughly over a telephone. Still in school, and I was not present for this patient's initial admission, but rather her clinic follow-up, however. Patient was healthy 50-something-year-old who had an extended nosebleed after a long hike. It wouldn't stop so they went to ER to get it cauterized/impacted, happens all the time. Anyway, they did a CT scan as protocol and discovered she had a 20+ cm tumor on her uterus that was wrapping around her right kidney. She was immediately referred to a serious academic hospital and had a specialized oncology surgeon remove it. Amazingly, they got it completely removed without even having to damage the kidney. She had an amazing outcome and about a half-a-foot scar running around her abdomen from the surgery. Edit for clarification, I do not believe the CT scan was due to the nosebleed itself, but rather I imagine as they looked further into her blood work and coagulation studies, they found something that warranted further workup. PSA, everyone who's a hypochondriac, stop reading this thread. Not a doctor's perspective, but my dad went to his doctor because he suddenly didn't like the taste of broccoli. Dad was otherwise healthy, late 60s, fairly active guy. He was diagnosed with leukemia. I was the patient. Spent 6 months being told I had a bad cold and anemia, so I should take iron pills. Turns out I had an autoimmune disease and my kidneys were failing. I eventually ended up on dialysis and with a transplant. I was the patient. My mom kept bringing me to the doctor because I was continuously complaining of tummy pain. I had just started school. The doctor said I was likely just trying to get out of school and stay home with my mom. I complained the whole school year. She even brought me to the ER a few times, and they essentially said the same thing. They never did any imaging, sometimes blood work. Finally one day I started peeing blood and she took me right to the children's hospital and I was diagnosed with stage 4 kidney cancer. By then it had spread to both lungs, liver, lymph nodes, and around the heart. Neurologist here. A healthy patient came in with a few-month history of left hand numbness. My first thought was carpal tunnel syndrome. But physical exam was not very convincing. I got CT head and found malignant metastatic lesions. Patient and family were talking about expensive designer bags, were very happy. I had to break the news. They went from healthy to potentially a few months to live. Sometimes I hate my job. Edit, I am reading replies of people getting worried about their loved one's symptoms. Remember, cancer is incredibly rare. Everything else is much more likely to be the case. I'm not a doctor, but I have two. I had a doctor appointment, just a 6-month checkup for my diabetes. My heart rate was up, so my doctor sent me to the ER for blood work. Turns out I was having a weird version of diabetic ketoacidosis, where my blood sugar wasn't elevated, anion gap. They kept me in ICU for a week. My mom went to her doctor for shortness of breath. He told her she was old and overweight. We took her to the ER, where they drained a couple of liters of fluid off her lungs. Her breast cancer from 5 years earlier had returned, metastasized, and invaded every bone in her body, her lungs, and her brain. She died 5 weeks later. I don't know if it counts, but I got bit by a bat and thought I should go get the rabies vaccine right away, and my wife said it's expensive. See if you even get sick, and I almost listened to her advice until I looked up what the first symptoms would be to know what to watch for, and everything was pretty unanimous. Once symptoms start, it has a 100% kill rate, and if you get bit, it's non-negotiable, you should go for the vaccine ASAP. Not a doctor, but my MIL tripped, broke her ankle, and they discovered she had bowel cancer really early because her blood work came up wonky. Not a doctor and not my story. Something I read on a similar post a ways back. An ER doc was running some baby docs through training when a disheveled man in an old rumpled suit, obviously homeless, came in complaining of nonspecific malaise. Kept mumbling about quantum whatever under his breath. Wasn't all there, mentally. She thought he was drug-seeking, but opted to run him through basic diagnostics to show the baby docs how it was done. Turns out the dude was in full-blown kidney failure. They put him on dialysis, and he just snaps into focus. Complete turnaround, 100% coherent. Turns out dude was an actual professor and expert on quantum mechanics and was riding a train to a conference when he entered kidney failure. It addled his brain and he wandered off the train at a random stop in a state of confusion. He'd been roaming the streets for months like that. Somehow didn't die. Crazy. NAD, but had a patient in my ER who came in for a lingering flu diagnosed with an extremely aggressive form of leukemia. Probably not particularly crazy, it might happen all the time for all I know. Not a doctor, but I went into urgent care thinking I had a nasty UTI, but it turned out to be severe sepsis, got whisked away in an ambulance on oxygen. That's what I get for my mom teaching me it's all in my head. Had a friend who had back pain in her lower back. Put it off, because it was the beginning of COVID. By the time she finally went, they found out she had tumors all over her spine. Not a doctor, but my husband suddenly lost 15 pounds over a few days. No changes to diet or exercise. I told him it sounded like diabetes, and please go. He finally went after a week, and by that time he was skin and bones. It was diabetes, and his blood sugar level was dangerously high. The doc said if he had waited one more day, he might have gone into a coma. Not a doctor, annoying, I know, but my mom kept having foot pain. Told her it was plantar fasciitis. Wouldn't heal. Then told her it was a fracture. Wouldn't heal. Then told her there was a growth. Did a biopsy, and it was lung cancer. Stage 4. So from foot pain to lung cancer. totally wild. She has also never smoked a day in her life. Not a doctor, I work in the CAT scan department. Had a patient who came to the ER because she thought she was pregnant and wanted a test. Happens so often, it's why they just don't get a test at CVS. Pregnancy test was negative and they sent her to me for a scan. Patient tells me she was having symptoms from her last pregnancy. Turns out she was having right-sided heart failure. Not a doctor, but work in health. Had a patient that went to her GP thinking she had arthritis in the knee from an old surgery and came back with a diagnosis of motor neuron disease. Obligatory not a doctor, had a 38-week pregnant woman with twins come in with a primary complaint of shortness of breath with exertion. She was 4 feet 10 inches. I'm thinking, of course you're SOB, as short as you are with term twins. I was pretty sure we'd do an NST and send her home. Her BP was 170/110, so we did blood work, and she was in HELLP syndrome. Platelets were 42,000. We were lucky she came in when she did. NAD, but I had a migrating headache, kept moving from base of skull to top for over a week. Non-stop, just kept on there. I ignored it and chalked it off to being in front of a computer all day. Started getting a pain behind my right eye. Still thought it was the computer. Everyone kept telling me I should probably go to the hospital and I kept saying no because I didn't want to deal with waiting in the ER for them to say I need to sleep more. Well, I went and they took me back thinking I had bacterial meningitis. Got a horrible spinal tap and came back negative. The only conclusion was my immune system was attacking itself and that if I had waited any longer than the week I already did, my immune system wouldn't have responded to any medication and just killed me thinking I was sick. Fun times. Fun times.